So very good evening to all the parents and all the students today who have taken time out to attend our webinar, which is exclusively for our Ganberry students. And today we have the Faculty of Medicine in Hradec Kralove, Charles University, Professor Emil Rudolf, who is the Vice Dean for Study Programs in English. Today he's with us and he's going to take us through the entire presentation. So without wasting any more time, I would allow Professor Rudolf to take over and share with his lovely presentation and share information to all our parents and students.
All right, thank you, Pranali. And hopefully I'll be able to share it. I'm sorry, I just need to share my screen. Good. All right, hopefully you see something.
Yes, Professor, we are able to see it.
So once more again, a very good evening to Dubai from Hradec Kralove. I'm very delighted to speak to you on this occasion on behalf of our Faculty of Medicine in Hradec Kralove, Charles University. My talk will be kind of brief, but I hopefully also illustrative and informative. So first of all, I'm going to briefly introduce the faculty and university, and then we'll introduce our program. This is Master Program in General Medicine, and briefly walk you through the conditions which are kind of like required for anyone interested and qualified to enter the program. And then a little bit about how the students feel, how our students feel to be part of the program, what it takes to study. And then perhaps a few more things about the place where all these studies take place, of course, because that's of relevance too, since it is a place in many different ways, different than the place many students who are candidates were born to. So as I was introduced, I'm a staff member of the Faculty of Medicine in Hradec Kralove at Charles University, but I'm also a teacher here, so I have to teach. So I'm the academic or academia member and also staff scientist. So beyond my administrative roles as the Vice Dean or just beyond, I'm also sort of pure teacher and a scientist. So I meet with the students on a daily basis, and I'm responsible for the progress in the studies as well. Speaking a little bit about the university or the academic institution I'm trying to introduce, Charles University is kind of relatively famous university here in the European segment, perhaps also with a bit of international fame, with a good standing and ranking in many different international ranking systems. It is also our largest university, which features quite a lot of students. It's currently estimated to be 50,000 plus, and it consists of the 17 different faculties offering a diverse array of the study programs. What comes up perhaps a little as a confusion point is that the same university also has up to 5 different faculties of medicine. Some of them are localized in the Prague, which is the place where the university itself resides. Some of them are outside, so I'm just talking to you now on behalf of the Faculty of Medicine, part of the Charles, which is outside the Prague, just to dispel any confusion and any sort of telltales and things. So we are just placed in Hradec Kralove, where we offer at the moment unique program, which is general medicine, which is a master's program. It's the full-time master's program, undergraduate program sometimes call it. The students for 6 years study, and when they graduate with the locally taken title MUDR, which is full equivalent to the MD title internationally recognized. The study program is organized along the traditional lines, means that it's composed of the 3 segments by the 2 years. For the first 2 years of study, the students usually learn the fundamentals about the structure and function of the human body, but also having a few lessons over the practical skills, especially over the first aid. Then the 2 other years are considered to be preclinical, that is year 3rd and 4th, where they are already in the hospital, where they take the basis of the diagnostic procedures, where they learn how the entire system works. And then in the 5th and the 6th year, they spend entirely in the hospital, where they are practicing by the bedside. And of course, they learn really day-to-day duties of the medical doctor. For the 6th year, they don't go in the classes, they rotate, and they prepare themselves for state exams, which is practically the end of their master's course. But there's 5 state exams: gynecology and obstetrics, then the surgery, internal medicine, then hygiene and social medicine, and eventually the pediatrics. So they prepare themselves in the hospital, and then they sit the state exam. Once they pass the final state exam, they successfully completed the study and they will graduate. Well, this program is in many ways very exciting, but also it's would say not really that easy as one might think, because it requires that the students master lots of academic skills, including, of course, lots of knowledge, but also they have the developed aptitude for practical skills, such as how to touch, how to take a diagnosis, and how to operate a patient, including also the portion of the soft skills, which means especially the communication, ethical standards, and also overall sort of attitude towards medicine, patients, and the human health. Our Faculty of Medicine is not large. That is also reflected by the number of the students we take in every year. So our intake includes maximum 105 students, plus or minus. At the moment, we have about 350, again, more or less students studying in all years. So that's not really a lot. And therefore, we could also devote our time and our efforts towards them, and we could make the training more personal, but also more intensive, and also more worthwhile of the study efforts. Since the entire study is in English, that is with the one exception, and that is the fundamentals of the local language, which is Czech, which is full and built in the curriculum, but still all the classes are taken in English. So it's the study which is not subsidized by the government, and therefore it needs to be covered by the tuition fees. Tuition fees for the upcoming academic year have been calculated to the number 350,000 Czech crowns, which probably doesn't tell you much, but if you want to just have it in your own currency, it's about the 52,000 dirhams per year. There's this tuition fee, and then there are kind of like a living expenses, which we estimate are around like 7,000 euros a year, which would cover all the student needs, including the accommodation, food, travel, insurance, leisure, plus also whatever else is needed for the studies. So just to know these sort of like a practical aspects of the course. Now, of course, the studies of medicine, what we offer are not theoretical ones only. There is a large part and a growing part of the practical training, bedside training, also simulation training, which happens in the university hospital. That's an affiliated institution which is the largest in our district or in our region. It has quite a lot of different employees, more than 5,000 doctors working in the departments and in state-of-the-art excellence centers. Normally, there is also high intake of the patients, and not only the patients for the baseline treatment, but especially the patients with the unique diagnosis and things. So that makes an excellent opportunity for our students just to learn about these high-tech medicine science, while also making the sound and robust fundamentals. The hospital is sort of like an institution number one, where our students take the classes, where the training happens. But that's not the only one where the students could choose when it comes, especially that there are 6-year practices, because in that case, they could use some other hospitals, either locally available on the district level, but they could also choose the hospitals in their home countries or in other countries where they could actually pass their pre-state practices. So the practical training of our students is not only limited with the one, although very large and very sophisticated, very excellent university hospital, but there are some other choices, which is a good alternative in many ways, especially when it comes to trainings in a specific areas of the medicine. I guess right now it's a time for me to speak a little bit about the criteria which are required for entry, because one might wonder, how could I enter? Well, it's relatively or comparatively easy. Now, first of all, a candidate should complete the secondary studies. The secondary school should be completed by the latest before the enrollment. So just to answer some of the questions which often come, whether at the time of the entrance procedure a student has to have completed secondary school. No, some of the candidates complete the secondary education only well after the entrance exam or procedures took place, but they need to complete them, and they need to have the certificate or the paper or some document attesting to their successful completion of the studies by the enrollment, which usually happens roughly about 3 weeks before the beginning of the academic year, so sometime in the middle of September. A good thing is that the completion of the secondary school is not further linked to any grades or to any achievements during this secondary school study. So as long as the study is completed, it's perfectly all right. So we don't look at the grades, we don't look even in the subjects the candidate took in the secondary school, as long as he or she would be able to pass through our standardized written and oral test. So once more again, a suitable candidate who would want to consider application to our program needs to complete the same year, the calendar year, the secondary education, and he or she has to submit an online application, which is available and which is accepted until the deadline, and that is the end of April 2023. An application process is already open, so anytime between now and this end of April 23, it is possible to submit an online application. It's kind of very easy because these are available on our website. It's sort of like a form and it's sort of automatic. The application form is though not accepted by the faculty unless and until certain fee is also kind of covered. The fee is roughly about 123 dirhams for the upcoming academic year. So something we believe is of relative acceptance. And then once the application process, at that stage, so the application is accepted, then the faculty will communicate with the candidate and eventually invite him or her for the entrance exam. The reason of our entrance exam is simple, because we do not have any objective means of evaluating different systems the secondary schools take, because in the past there was often an argument that the A-levels or the American curriculum or the CBSE or any other systems which are used in the different countries and different schools are of superior or the equal quality. So all of them are definitely of high quality, but we have no way of comparing them. So we cannot admit students only as based on the achievements in these systems. So that's why we have a standardized test. The test is composed of the 3 most common subjects which are taken in the schools, in secondary schools, by the candidates who would consider medical studies, and that is biology, then chemistry, and choice between the physics or mathematics. So for the test is 25 questions in biology, 25 questions in physics, in chemistry, and 10 questions of either physics or mathematics. Each question is single best answer. And the test itself is available on our website. There is a past test, so it could be downloaded, and also the syllabi. So every candidate who is just sort of acquainted with this information from our website should not be really surprised. And after this written form of written part of the entrance, then there is a short oral interview, really very short, but like 2 questions, which are just about the motivation of the candidate, communication skills, and also ability to decide, take a critical decision and interpretation. So something a candidate should not worry about, should not really prepare himself or herself specifically. It's something like which we'd like to know, because that reflects his or her personality and also eligibility for the studies. So that's sort of like a procedure. This procedure happens in a collaboration with our trusted partner, Jamboree, twice a year. For the upcoming year 2023, has been fixed on the end of January, actually January 28th, if I'm not mistaken, and April 22nd. And so those who live in the Dubai region or in the Dubai itself, for them it's convenient because they don't have to travel anywhere, and they could just sit the exam, at least the written part, very conveniently at this place they know, and they're not really stressed. How to prepare for the admission was something I already explained, so it will be really very wise to download the example test from the last year, or actually from this year now. We have already provided to see the questions and answers which were provided. There is also a syllabus and recommended literature for those who would want to fill up a little bit their own knowledge in case that they don't feel that some of the questions they were asked are the ones they really know, so they have all help. And of course, they could always ask questions. They could follow us on the different social media or write an email. And I believe they could also ask our partner because they would get the qualified answers. So when the student or candidate is successfully admitted to our faculty, usually he or she receives a letter of admission, where there's some other detailed information about what should be the next step or what should be next series of steps are detailed. And the candidate should immediately consider, of course, some of the practical steps, that is especially application for the visa procedure, which is somewhat the special sort of part of the intergenesis, and I'm not going to discuss on that because the detailed information as well as the documents are provided on the faculty, and I believe again our trusted partner would be of assistance when the application for the long-term student visa is concerned. So that's just this. I would say like a post-admission series of steps. So I'm going to focus instead on very quickly on what it takes to be a student. As students, they enter the faculty, they enroll. Academic year usually begins at the beginning of October and is until the end, almost the end of the September of the next year. It is composed of the 2 semesters, winter and summer. In between them are examination periods where the students do not take classes, but they stay at home or whatever place, and they do study and prepare themselves for exams. The studies are really versatile, and they combine both traditional as well as the new forms of the study. So lectures, seminars, practical simulation classes, bedside teaching, e-learning courses, the various video tutorials, and whatever databases, whatever is today is used. Then once they study, they need to prove I mean, the students, that they learn things, so they send exams. Most of the exams, final exams of this type of the study are oral. So they could see them either in the winter or in the summer. They have 3 attempts for them. And of course, there's plenty of exams which are also written, that is like a progress test, in order to monitor the progress of the students and to make sure that the students are not really slipping or not having any issues. So I guess this is kind of very similar to what one might expect would happen when we enroll in the university. Now, towards the end of my talk, I'd like to briefly introduce the HK. Why HK? That's really a very relevant question. Well, the HK is neither big enough to cause stress and to feel as like a one little grain in a million of grains, being totally anonymous, nor too small to feel really on the village. It's just about the right size, we believe, and the students would feel that they're in a larger place, so they will have their own freedom. They will have lots of different choices, whether it comes to nature or to other people, other students, to different amenities. But at the same time, having really their favorite spots, they could hang around, they could actually pass the quiet minute if they want to be alone, or just the place where they could celebrate or enjoy the life with the friends. The place is we believe, on a convenient size, which is also reflected by the fact that it's easily navigable, which is one of the certain advantages we could offer to our students and all those who stay with us, because everything is within easy reach on foot or on the bicycle. So our students, we don't really waste our time while commuting, while trying to get from one place to another. So it's very economical. Also, being of this relatively idle size for us, it means that the place is very safe, and safe in a natural way, not like we see the police every day on the streets and all constantly patrolling, but simply the people respect each other. They're used to students from different countries. And then they show the hospitality, and that is also reflected in sort of like the friendliness and the safety the students feel. Our students have one advantage too, and that is that they are provided with the access to lots of literary resources. They are provided also literature, and they don't need to really buy it on their own, and they don't need to worry about where to get it. So that's really comes in handy, especially if you face, or if the student faces lots of the tasks. So, and he doesn't have, or she doesn't have the time. So to know that where to access the information, how to study and what to study is of really relevance. The studies take place in a very, very modern rooms with the really state-of-the-art and equipment and the facilities, be it in the first year in anatomy, or in the histology, or be it in the molecular biology techniques. All students are also increasingly more fond, and they use so-called simulation medicine, or simulation centers, where they work with the really sophisticated dummies in order to learn and to practice basic skills and hone them before they could touch the patient, because that relieves them from the strain of stress, because they know exactly, sort of like automating their own sort of like skills. So that is also part of nowadays studies and medicine. Our students would also benefit from the brand new centers of the teaching and research, which are going to be expanded, and they are staying close to the university hospital, where not only classes are taking place, but also students are incentivized to do a research, not only because the research is a part of the studies, but also the research gives them credentials. Research earns them the points for extracurricular activities, which could be used for the students to ask or request their presence in a scientific conference, and especially in the States. Because our faculty, as many as other faculties, offers also some unique stays for those of the students who are best in the studies and also best in their research. One of them is very celebrated international experience in the Mayo Clinic in Rochester in the US, where annually we offer the 3-month stay for selected number of, as I said, excellent students with a research experience, which is true gateway to the postgraduate training as well. Because once the students graduate from us, they must decide what to do next. And often they need to learn experience and to enroll the residency programs. And whether it would be in NIH in UK or in the US or anywhere else, all these places are usually conditioned with some extra credentials or extra sort of like a points, which could be provided by these scientific stays. Rest of that is part of the modern life. So not talking about the food and accommodation facilities, which range from private ones to the public ones. But most importantly for our students is also our attention to their own progress. That is, that we have our own doctors who take care of them. So like a points of contact, but also we have our own counselors from among the academic staff, but also professionals who are available just to and for talk or for consultation in case that any minor issue offers with or occurs in our students, including like temporary depressions or some issues the students feel that they just prevent them from really intensive studies. So all that is for their own benefit and for their own convenience. Last but not least, of course, is the other part of the life. Studying of medicine is first place fun. Fun, which some people might find it a little bit stressful, but still fun. And our students make it even more funny while just organizing lots of different extracurricular activities, including both the arts, including the diverse sort of meetings, and of course the sports, and very wide range of the activities. Our own International Student Union, founded by our international students, recently launching many different activities, such as the student magazine HK Digest, or Corpus and Animals, sort of like a philosophical or interactive society, including our context with similar sort of like activity groups on different faculties of medicine. Make simply the studies in our faculty fun, which is more than necessary to compensate for the rather intensive lessons and studies our students need to pass. Well, and then altogether, it would provide for 6 years quite an intensive segment of the life of the candidate or the student. Eventually, after 6 years, the students will gather in the very oldest place of the Charles University called Carolinum in the Prague, where the ceremony I'm showing here in the photograph, they're given a title of the MD diploma, and they become our successful alumni club members, and they could collaborate with us more, but then they would follow their own own decision in terms of which medical system to enter and what specialization to take in order to fully complete and enroll their own medical career. All that was very intensive with a lot of information, I believe. It's just sort of like a machine gun. So of course, the most important is then the communication. And the communication happens with our faculty on many different levels. Of course, not only the emails, not only the phone calls, personal visits. We're going to organize the open day in the coming February, which will be both in person, but also online. So all that could be further followed, including, of course, our social media, whether Facebook, Twitter, or the Instagram, where any dropped question would be immediately taken up and then answered, and lots of buzz in the faculty could be observed. So that is all for this initial introduction from my own part. I hope that I just gave you some initial info, which might just eventually result in your decision making. HK, among other things, is a really nice place to visit. So part of your decision making should also be perhaps a short trip to the Czech Republic. Enjoy the Czech Republic as such, and also visit the HK in a place where you might be willing to study, just to see how the atmosphere and things. Because eventually our decisions are influenced by emotions, and we cannot get emotions by just simply looking at the photographs, but experiencing them. So you're warmly welcome. Thank you very much for you, and I'll keep my fingers crossed for your decisions. Goodbye.
Thank you so much, Professor, for the lovely presentation and the information which you've given to our parents and students.